Surgery, portion of surgery from MTB Master the Boards. Shocking reminder. Cardiac output is equal to stroke volume into heart rate. Stroke volume is end-systolic volume minus end-systolic volume. Cardiac output is equal to end-systolic volume minus end-systolic volume into heart rate. And total peripheral resistance is total arterial pressure minus venous return, or blood pressure is cardiac output into total peripheral resistance. 74-year-old woman is brought in for respiratory distress and altered mental status. Her medical history records right-sided hemiplegia from a stroke several years ago. She has blood pressure 86/52, heart rate 123, breathing rate 33, temperature 102, oxygen saturation 84. Exam reveals bronchi bilaterally with E to A changes and warm extremities with faint pulses. Chest X-ray shows bilateral infill shades. What is the likely etiology of these patients? Hypotension, neurogenic shock, septic, hemorrhagic, hypovolemic, cardiogenic. तो ये होगा septic shock. This patient is presenting with 3 SIRS criteria: hypotension, tension, altered mental status, and a source of infection is pneumonia. The physical examination is also consistent with the septic shock. Massive vasodilation has yielded warm extremities and faint pulses. Both hypovolemic shock and cardiogenic shock would have pale and cool extremities. There is no mention of bleeding, ruling out hemorrhagic shock. Then, an 85-year-old woman presents with nausea, vomiting, and profuse watery diarrhea of 4 days duration. She was recently on a cruise ship where many people fell ill due to norovirus. Today, she lost consciousness in the emergency department while talking to the nurse. Her BP is 70/40, heart rate 110. Placement of Foley's catheter in the ED yields no urine output. Which of the following is most likely? Diagnosis: septic, anaphylactic, hemorrhagic, hypovolemic. The answer is hypovolemic shock. और तो this patient is hypovolemic. Hypovolemic shock caused by hypovolemic shock है caused by intravenous volume loss. Common findings in a patient with hypovolemic shock are unstable vital signs. जो कॉमन फाइंडिंग्स होती हैं इन अ पेशेंट विद हाइपोवोलेमिक शॉक और अनस्टेबल वाइटल साइंस, organ dysfunction such as low urine output, cold claiming extremities, and lightheadedness. The low volume decreases the cardiac output because of lack of preload, while meanwhile systemic vascular resistance increases in an effort to compensate for the diminished cardiac output and maintain perfusion to the vital organs. तो ये कौन सा हो गया? हाइपोवोलेमिक शॉक. क्योंकि हाइपोवोलेमिक शॉक में ये किस वजह से हो रहा है? इंट्रावीनस वॉल्यूम लॉस होने की वजह से हो रहा है, और इसमें अनस्टेबल हो जाती हैं वाइटल साइंस. ऑर्गन डिसफंक्शंस हो सकता है, ऑर्गन डिसफंक्शन में यूरिन आउटपुट डिक्रीज हो गया, कोल्ड क्लेमी एक्सट्रीमिटीज़ हैं, लाइट हेडेडनेस है, और वॉल्यूम कार्डियक आउटपुट को डिक्रीज़ कर देता है. लैक ऑफ प्रीलोड की वजह से ये हो रहा है, जबकि एसवीआर इंक्रीज़ हो रही है टू कंपनसेट करने के लिए डिमिनिश कार्डियक आउटपुट को. Then an 11-year-old boy who was given a suspicion of suspension use of amoxicillin for acute otitis media a few hours ago is now in severe respiratory distress. So his eyes and lips are swollen. Eyes and lips are swollen and he is having difficulty swallowing. So his blood pressure is 70/40, heart rate 130. Child is unable to speak. Exam relief bilateral wheezing and tachycardia. So what is the likely diagnosis? Anaphylactic shock, cardiogenic shock, sepsis, pulmonary embolism, pneumonia. तो ये होगा एनाफाइलेक्टिक शॉक. This acute onset illness involving the skin and mucosa combined with respiratory compromise है, reduced blood pressure है और subsequent end organ dysfunction है is anaphylactic shock. The trigger for this child is most likely severe allergy है इसको to penicillin. So it cannot be sepsis because there is no fever and onset was sudden rather than gradual. ये सेप्सिस नहीं हो सकता क्योंकि फीवर नहीं है, चिल्स नहीं है और सडन ऑनसेट है rather than gradual. Pulmonary embolism would have a normal lungs examination. अच्छा pulmonary embolism होता है, normal lung examination होता है and it is not plausible that a child this young would have pneumonia without a fever or cough.